Bismillahirrahmanirrahim. Assalamu alaikum students, how are you? Let's start today's lecture. Today we are going to discuss the pterygoid venous plexus. What is pterygoid venous plexus? Pterygoid venous plexus is the plexus of the veins which is present over here in blue and okay. So this one is the pterygoid venous plexus, and it is the plexus. It means that some veins are bringing blood and some are draining. So three types of veins are bringing the blood to the pterygoid venous plexus, and these three types of veins are coming from the cavernous sinus. This is the cavernous sinus, and from cavernous sinus the veins are coming which are emissary veins and which are bringing blood from the cavernous sinus to the pterygoid venous plexus, and the other one is from the inferior ophthalmic vein. This is the inferior ophthalmic vein, and from inferior ophthalmic vein, from the inferior orbital fissure, the inferior ophthalmic vein blood is bringing. Okay, the third one is from the facial vein. The facial vein, you know what it is, the facial vein. The facial vein is collecting blood over here, but it is directly communicating with the cavernous sinus through the deep facial vein. This one is the deep facial vein. Okay, so deep facial vein, inferior ophthalmic vein, and emissary veins. These three types of veins are bringing blood to the inferior pterygoid venous plexus, and from the pterygoid venous plexus the blood is drained by this vein. This is the maxillary vein. This vein, three veins are bringing blood to the pterygoid venous plexus, and one vein is bringing blood away from the pterygoid venous plexus, and this vein is the maxillary vein. From the maxillary vein blood is taking away, and from the maxillary vein joins this other vein, this vein, as I am this vein. This is the superficial temporal vein. Superficial temporal vein is joining the maxillary vein, and we are having another vein, this vein, this vein, this vein, as I am pointing out, this vein. This is the retromandibular vein. The retromandibular vein is dividing into an anterior devian and a posterior devian. So we have discussed a lot of time about the anterior devian, about the face blood drainage, venous blood drainage from the face. So this is all about the pterygoid venous plexus. I will explain it once again. And this is the pterygoid venous plexus. This is the pterygoid venous plexus, and it is communicating with the cavernous sinus and with the ophthalmic vein and with the facial vein, and the blood is draining out through the maxillary vein, and the maxillary vein is joining the superficial temporal vein and forming the retromandibular vein, and the retromandibular vein is dividing into anterior and posterior devians. So all this procedure is carrying out. Okay, so all this procedure is carrying out. Over here a muscle is present, and over here a muscle is present, as I am drawing. The muscle is present behind it. This is the lateral pterygoid muscle. The lateral pterygoid muscle. On the lateral pterygoid muscle, the pterygoid venous plexus is present. Okay, so the maxillary artery, let me show you another picture. This picture, and this picture you can see here. You can see this picture is a clear image of the veins which is showing you. So hopefully you understood everything. If you have any other question, any query, you can ask. Thank you so much. Allah Hafiz.